One happy second anniversary to PAPERI. So today I'm here to address one of the most essential questions which have been coming up in our continent. The question is, are we ready for genomic medicine? And if we are ready, how do we overcome the barriers? First of all, yes, as Africa we are ready for genomic medicine because we have to be. For too long, African genetics has been underrepresented in the global research. Patients die having those genomic diseases. They die suffering from diseases which would be treated by genomic medicine. So the other part was, how do we overcome the barriers? So I have 4 main things on how to overcome the barriers. The first is to ensure public trust. How do we ensure public trust? By organizing webinars, TV sessions, going to communities, speaking to people, explaining to them what exactly genomic medicine is and what it does. For that, we shall be building trust in our societies, in that, in case genomic medicine is made mandatory or is available, people will be running for it, people will be participating in the treatments because they trust the medicine, they trust the system. Then my second point is the infrastructure. We must move away from shipping samples overseas, because as Africa, let me focus on Uganda mainly. As my country, Uganda, we overship samples from overseas instead of making our own genomic medicine. So by investing in local sequencing hubs and biobanks, we ensure that data and the resulting medical breakthroughs stay right here in Africa. People out abroad don't have to be recognized, but it's the African scientists which have to be recognized. My third thing is education. Genomic medicine shouldn't be restricted to researchers, because at some point people might think that genomic medicine is for only researchers, yet it is for everyone in the society. So we need to empower our clinicians, nurses and pharmacists with the training to use genetic insights for precision in prescribing the right drug at the right dose and the first time. Then my fourth thing, public trust. Actually, it came up as my first thing, but I'm bringing it back. Public trust. This is our most important barrier in Africa. Convincing people that genomic medicine won't really lead to their extinction. That is the main problem we have here in Africa. But how do we overcome that barrier? We must deal with transparency and strong data protection. Most people are scared that what if my genetic results are seen by my employer? What if they are seen by an insurance company? How will they react? What if they stop giving me insurance? So we have to put strong data protection rules. Then when our communities see that DNA donation directly leads to better treatments to local diseases, we build a foundation for lasting trust. When people get to acknowledge the fact that the genomic medicine is working, it is removing sickle cells, and sickle cells is no longer affecting people, this will build lasting trust and people will be coming for these genomic medicines. And then, in conclusion, what I close with, genomic medicine is no longer a luxury for the future, it is a tool for equity today. By building local capacity and fostering community trust, Africa won't just join the genomic revolution, we will lead it. Once again, happy second anniversary to PAPERI. Thank you so much for all the policy advocacy efforts. Thank you.